When you're working with an individual where you're suspecting potentially disordered eating, eating disorder, some fiddling with food or possible malnutrition, what are you assessing?
I always like to come at this like every patient deserves to have a full assessment of their whole lifestyle, behaviors, all of that, because that's the most of what we can control around our health is our lifestyle and behaviors. And even
Right.
some of that we can't control,
Yeah.
right? We're not always in control of our environment and all the other things that affect our lifestyle. But, I think for the things that we can control, I think it's really important to have a thorough discussion about it. And so this is something I do for every patient, regardless of whether they are referred to me because someone thinks they have an eating disorder or they've experienced struggle, they're in treatment, whatever. I'm doing this for every patient.
Yeah.
And so, what that looks like is just doing a full assessment of health, past medical history, family history, current living circumstances, employment circumstances, all of the life and genetic things and history things that affect your health. We got to have that framework to know where we're coming from. And then we want to look at your basic lifestyle and behaviors now, like what's going on now, not just with food and exercise, which is what I think a lot of people tend to focus on when
Right.
it comes with lifestyle and health, but what is your sleep like? How are you managing stress? What stressors are there in your life? What like environmental and socioeconomic factors are actually impacting you right now? And what can we do about them to help you manage them better?
Yes.
Um, and then, looking at any substances that you might be using, whether that's caffeine or alcohol or cigarettes or other drugs, looking into the big picture of all that. So I always tell it's like my five S's. We have sleep, salt, which is what I is my standard for nutrition. Sedentary, are you sedentary or not? Stress, and then substances. So that's my like five
I
S's.
love this little trick. Okay.
Yeah.
Five S's.
Yeah.
Noting,
Yeah.
noting.
And so everyone should have that assessed because generally
Sure.
speaking, one of those is not going well, at least for most people.
Mhm.
And there's always things that we can do to intervene. And I think, like I said, so many people focus on the diet and exercise piece to the point of like significant restriction or over exercise, or like they're really like hammering in at the diet and exercise. But if one of those other things is on fire, that stuff is not that important.
Right.
We got to address those other things too.